Hello, I'm Sinta from Fair Divorce, and today we're going to talk about drugs and alcohol abuse and how to detect it. With me is Dr. Tim Lourens. He's a forensic toxicologist with 40 years experience in this field. Dr. Lourens, thank you very much for being here and welcome.
It's a pleasure. Thank you for having me here.
If I could quote your website, it says that you do confirmation testing for family litigation and disputes that are related to divorce and child custody. So I want to ask you, first of all, what is legal, what is illegal in terms of drugs, and when is drug and alcohol use acceptable and when is it excessive?
Yeah, legal and illegal. There's, of course, cannabis or alcohol are both legal nowadays, but it still has a very big impact on the individual using it and his family as well. So the illegal drugs are usually listed in the schedules of the Drugs and Drug Trafficking Act. Those are typically, and cannabis can still be there depending on the amount that you have and the way in which you use it as well.
Mm-hmm.
But it's legalized for private use in private by adults. So illegal would be all the substances like cocaine, heroin, and all the other substances listed. But remember, the use or inappropriate use of prescription medication is also in a way illegal.
Mm-hmm.
So it's not only listed drugs or scheduled drugs, but also prescription medication. So the way in which you apply or administrate these drugs are also illegal. So then you have also the legal drugs like coders and syndols, for instance, and codeine is also a very important substance that are misused. And it's a Schedule 2 type of drug. So it depends on how you use it in terms of appropriateness. If you inappropriate administer these drugs, they do have an effect on the body. So it's not only about legal or illegal. Maybe if we detect something that is illegal, it may indicate risky behavior.
Mm-hmm.
It doesn't mean that inappropriate use of alcohol is not also risky, or the use of steroids. It's also risky behavior because it makes you aggressive. So one must be careful when you start classifying drugs into illegal and legal. More in terms of, I think, a more acceptable way to classify these is in terms of the use, the appropriate use of these substances.
Yes.
What was your other question?
Yes, I just wanted to clarify what is legal and illegal and when is it excessive. So if we look at it from a family perspective, because that's what I deal with is families that go through separation and divorce. I heard what you said about the way that it's used, and then obviously the impact that it has on a family is what we need to look at. So that was my question be, when is it excessive then? Which I suppose depends on each unique situation.
On each situation, and also if it starts affecting the people around them. Like binge drinking, definitely it has a huge effect, and inappropriate or heavy drinking is for instance, of alcohol, and the same will apply to drugs or other substances as well. The person still has control and over the quantity and the frequency of his use. He still has control, but he starts to begin to develop a pattern of use. And he starts devising these reasons for using without others' knowledge in private. So he starts to use it in private, of course, and he starts to make these self-imposed rules. You know, I will drink only at parties. But still, binge drinking is part of this. So it's still not, and the amount that is used is, of course, important. For instance, it would be inappropriate use, and it depends on the person. And it depends on the person's metabolism ability as well, the metabolizing ability, if he can metabolize alcohol fast or slow. But 3/4 bottle of red wine per day is typically an indication. That's more or less 60 grams alcohol per day. That is defined as inappropriate alcohol use. That's where it really starts to affect people. For instance, beer, let me just, I had a look just now about the the quantities. For instance, beer would be a standard 4% beer would be 7 beers per day. That's approximately 60 grams of ethanol per day. I cannot really say how much TIC should be used when it's inappropriate, because it has a completely different pharmacology, or how much codeine and syndyls are used, because syndyls or codeine is also misused or abused. So it's about the way in which it's used. So glasses of wine, typically six glasses per white wine per day would be sufficient to classify as inappropriate use. But it depends on your body weight. If you are a small person, obviously, then 5 glasses would be sufficient. 4 glasses. There's a difference between women, females, and male metabolic patterns as well. Even different races metabolize at different rates.
Oh, that's interesting. Yeah.
Very much. So there's a lot of detoxifying enzymes in the body, and it depends on our genetic expression, how good we can metabolize. So if there's a block in the metabolism from ethanol to acetic acid, obviously the ethanol accumulates, which is the substance that actually has the effect on you. So it accumulates, it stays long in the body. That person would have a higher chance of alcoholism as opposed to a fast metabolizer. So sometimes the metabolism from acetic aldehyde to acetic acid also is a problem, because if there's a block, acetaldehyde is accumulating in the body, and then that person has a very big hangover. He doesn't like to drink. So our genetic makeup has a big influence on how we use alcohol and of course drugs as well.
So we're all going to handle our drinks, or our drugs for that matter, differently. Very, very interesting. Okay, so 6 glasses of wine to me seems like it would kill. I would die by the second glass, I think. So it's different for people, and some people can hold their liquor better than others, as the expression goes. Something I see
influences your way of life. It starts to affect. It doesn't have to be 6 glasses. When you start to develop a pattern and get irritated with people and become aggressive, because some people can actually become aggressive after 2 glasses of wine. So it depends on the individual.
Yes, so the behavior is important that results from the use of it, if I understand. Yeah. So something I see quite often as a divorce mentor who coach people through separation and divorce is the accusations. You're a drunk. You're an alcoholic, and it's cited as a reason for breaking up, or it's actually cited in the court documents and the summons, and it pops up all over the place. It's easy for us to accuse people without proper grounds to do it, and that's where I imagine you come in, is to do the confirmation testing. Can you tell us more about that? What is that? I know you have different types of tests. How do they work? So where do we start if I want to use the abuse of alcohol or drugs as grounds for whatever it is I want to fight about?
Sure. There are 3 very important factors, four steps that you have to go through before one can actually make a diagnostic, because that's what you actually do. You make a diagnostic conclusion from the information that you have. And the drug test result is only one part of it. Okay. So the other 3 is the social function. You must make an assessment of the person's social functioning, and that's where the accusations normally comes into. The social functioning is not good. Medical history is very important. You know, are there any effects, medical history, and questionnaires, standardized questionnaires? But people lie when you ask these questions. So the 4th leg would be to at least identify, confirm the use of the substance in the body, that the body was exposed to the specific substance or substances. Okay. So for that, we require a drug test. And I will explain to you just now the different levels of drug tests, but you require a drug test that can confirm that the drug is or was in the body. And from that point onwards, you can use other type of approaches to assess the amount that was used, to give you an indication of the pattern of use. Okay, so there are two levels in your assessment. So the drug confirmation testing or the alcohol confirmation testing requires evidence and legally defensible evidence that the substance was or still is in the person's body. So we look for the drug itself.
Okay.
Now, after 3 months, how do you detect alcohol in the human body? Because the alcohol is out long gone, but it still sits in the hair. It's accumulated in the hair as well. Remember, our hair is like a hard disk backing up all the time what is recording what is going on in your body.
Yes.
So there's a substance related to ethanol that gets accumulated in the hair, and we can detect that substance as a marker of exposure, as an indication that there was definitely ethanol in this person's body, or there was cocaine in this person's body. All right. Now we need to use secondary markers to assess the effect. And it so happens that one can use that very same substance that we detect as a marker of exposure also to give the indication of the effect, the amount of alcohol that is consumed. So that is a very unique marker for alcohol in hair. It's called ethyl glucuronate. For cocaine and for all the other substances, we don't have that history and we don't have that clinical data really. We can detect cocaine in hair, but it's difficult to relate the frequency of use and the amount that was used. Of course, we can do profiling in hair to tell you this month the person took so much, the next month he abstained, and the month after that he used a different drug, because we can segment the hair. But for alcohol, it's a socially acceptable drug, and cannabis lately as well, but we don't have all the clinical data for cannabis yet, but it will come. I want to tell you something very interesting about cannabis. But for alcohol, now we have proved that after 3 months, we can prove that the person was exposed to excessive amounts of alcohol. There's other markers that we can also use, which is called markers of effect, where we can actually assess the effect that the alcohol has, because we now prove that alcohol was in the body. We look at liver function markers like gamma GT, carbohydrate deficient transferase, etc., in combination to assess the liver damage that was done. And that can be correlated with the frequency and amount of use for alcohol. But one must be careful. For instance, CBD oil can also elevate some of these markers. And CBD oil is something that a person may buy legitimately over the counter in good faith.
Yes.
And to complicate matters even further is the fact that the CBD oils that are sold over the counter in our country is many times contaminated with THC, which is the active constituent of cannabis. So now, how will you know? Now you detect THC in this person's body, and he actually consumed this legitimately without even knowing. How do you handle that situation? So that is really a difficult problem. My suggestion, and we have done that, we look at the CBD versus THC ratio, because if it's a legitimate THC user, the THC will be very high compared to the CBD.
I see.
And the other way around for CBD will be elevated. So we have to look at the ratios now to identify the person's, if he speaks the truth or not. So look out for that as well. I think it's very important, because someone can really, his parental rights and responsibilities can be really affected, although he used CBD oil legitimately within the limits of our constitution, because we have the right to health as well. We have the right to medical treatment, and we can also treat ourselves. So if someone believes that CBD oil is good medication, he can use it, because there is nothing illegal around that anymore. So that complicates matters. One must keep in mind, because our legislation is not properly maintained.
Would that be similar to stories that I've heard of people using antidepressants or other kinds of prescription medications that also have components or traces of elements that can be construed to be drugs or illegal substances?
Look, it depends on which way you do tests, because now you have two levels of testing. in addition to the different type of markers of exposure and markers of effect, there are two different levels of tests as well.
Mm-hmm.
So the first level, or it shouldn't be used in this environment, it's used in the safety environment like workplace testing. They do a preliminary screening test.
Mm-hmm.
And those tests are subject to interferences from other medications. So maybe someone uses a flu medication.
Yes.
Now he shows a positive for opiates, for instance, or positive for amphetamines. But we must remember those preliminary screening tests are designed to detect families of compounds.
Mm-hmm.
So that preliminary screening test is exactly what it says. It needs to be confirmed.
Okay.
The preliminary test is also designed to detect above a certain threshold, not below. So if it is below, you may miss, a parent may go, or cocaine user, for instance, may go undetected because the wrong technology is applied to this test. So I say, and it's common knowledge, rather use a confirmation, a forensic confirmation test as we are doing in our laboratory. Because the detection limit is very low, we can detect if someone uses cocaine. And we can simultaneously identify whether this medication contained heroin, which is also an opiate and illegal, versus codeine, which is legal.
I see.
Also look at codeine abuse simultaneously, because codeine and morphine will have a specific ratio if codeine is abused, symbols are abused. So that gives you so much more information. Now, they always compare the price for a confirmation versus a preliminary test. The point is, preliminary testing results cannot be used as reliable evidence in any form. I think the gravity of this situation actually demands confirmation testing.
So these over-the-counter tests that we can buy from Dis-Chem and the chemist and what, where do they fall? Are they
preliminary? They are preliminary screening devices.
Okay.
Those test results must be confirmed before you take any decisive action. Otherwise, you might harm that person very much.
Yes.
And if the child is taken away from his parents, you harm the child unnecessarily. Or the other way around, if the parent goes undetected, you may also harm the child. So the whole process must be in the best interest of the child, as our Constitution and the Children's Act requires.
That makes perfect sense. So it's important to know that the screening tests that we buy over the counter are not 100% accurate. Because
No, definitely.
Yeah.
So you have a 20% chance typically, because the testing technology is not designed for decisive action.
Yes.
It is designed as, it's like you are looking in Cape Town for a green Citroen or a green Maserati.
Okay.
Now you have a screen routine which actually selects all the green cars.
Yes.
That's what the screening test does. Now you have to investigate which one is the green Maserati.
I see.
And that is actually what the confirmation test does. Is this really green Maserati or is it a green Ferrari?
Okay. Yeah, that makes perfect sense. And that would be blood tests.
No, that you can do that in urine. That's what I said, the confirmation that the substance was in the body. And that is, it's not necessarily a blood test, because remember, your time span for blood tests, you have 2 or 3 hours. Then it's out. So it must go somewhere. The drug must go somewhere. It goes into the hair, it goes into the urine, it goes into the oral fluid, it goes into the nails. So the most easily, or the most appropriate samples would be urine for short term and hair for long term in your environment.
Yes. Okay.
So screening analysis is really not suitable for any decisive action. And I don't know why in South Africa this took off, because it's actually an inferior type of conclusion, and in many times results in in very unfair decisions. Think about the example that I mentioned now about the CBD oil. I know of a father that claims he uses CBD oils, and because it's his medication, and he's not allowed to see his child. So now we need to consider, is this CBD oil perhaps contaminated with THC? I think he has a case. I think he really has got a case. I would appeal that decision, that court order, definitely.
Well, that makes sense because the four things that you said we need to do is the test, the social functioning, and the medical history, and identifying the substance in the body. So in his case, the medical history and the social functioning hasn't really been considered, because if it was, then he wouldn't have had that outcome.
Now, what if he rehabilitates, if he starts to behave properly? He stops using drugs, but now he uses the CBD oil and he still shows up positive for THC. That's a very harsh accusation to make. And CBD oil is legitimate.
Mm.
So we must be very careful about the conclusions that we make.
So there are pardon?
Sorry? No, carry on.
There are many instances that I'm also aware of where parental controllers and facilitators, or even mediators or therapists, have an arrangement for somebody to come into their consulting rooms and do a so-called screening test. And a lot of decisions are based on that, or people do it at home. Or I know of parents who demand a test before the other parent can collect the children for a visit, and that sort of thing. It happens all over the place, and people are taking control of these tests and making decisions, and it's actually not really reliable.
Absolutely not.
Yeah.
As I said, what you actually do is you screen for all the green cars in Cape Town.
Yes.
And there are many. So on that point, one must be very careful, because we must, in terms of the Health Professions Act of South Africa, someone who perform a medical test or a biomedical intervention on someone must be registered at the HPCSA. So I think that person who performed that test in his or her office will be liable, because it's a biomedical intervention, and that person is not skilled to make a medical conclusion. And that, of course, can amount to assault if the individual did not give proper consent, or under force, or if malinformation is communicated to him. So it may amount to assault, private liability. Also, you may be liable in terms of the act itself, because you're not registered. And the standard which you or that person will be measured against, the test will be, what would the reasonable doctor do when he performs such a test? And the reasonable doctor who understands his field would do a confirmation.
Yes.
So that is medical malpractice. So I can only warn people against that practice. Don't do the tests on your own, in terms of your own profession and your personal liability as well.
Yes, that makes sense. It's treacherous ground to tread on. From the other side, as a person who is suspected of using drugs or abusing drugs and alcohol, would it be fair if I was asked to test, to refuse to do a screening test and say, I will not do this, but I will agree to do a confirmation test? Or do you have to do both tests?
No, in your environment, don't do the preliminary screening test. It does more harm than anything else, really, because the moment there's a suspicion around an opiate, then suddenly that person becomes a heroin abuser instead of a codeine user. Yes. He might have taken a Sindel last night. So the suspicions and the accusations that gets thrown around is too much. Maybe he used cough medicine or some ephedrine or pseudoephedrine. Now he's an amphetamine or a tuck user. So in addition to the scientific inferiority of the screening or preliminary test, I would rather use a confirmation test, because then you have the accurate information first time around. What was your question? Sorry.
No, you answered it. I said if I was a person who was demanded, a test was demanded from.
So I won't do the screening test, because the accusations are just too much. Of course, in terms of your rights or your human rights, well, we can all refuse something because we have autonomy. We have the right to decide for ourselves according to the Constitution, but remember, our rights are not absolute. it may be limited according to our section 36 in the Constitution. And I think in this case, the reason for limiting your refusal or your autonomy is the best interest of the child.
Yes.
And I think that's the way the court would look at it.
Okay, but valuable information for a parent who is maybe falsely accused or in an abusive situation is to agree to a confirmation test and not the screening.
Those are just too much.
Yes.
There's already mistrust.
Yes, I think people make assumptions based on the results, and it's actually made in ignorance, and that can do a lot of harm.
Very much. And the child must be kept in mind,
yes.
Because if he loses a parent unfairly, it's really unfair to the child and the parent, of course.
True. The whole family would suffer as a result of that.
Definitely.
What about the people who do really abuse drugs and have ways to get away with it? I know drugs stay in the body for different periods of time, and the people who are regular drug users are aware of these things. How they have ways to get around it, to sort of trick the tests. What's the term that I can use?
They can trick the screening preliminary test, yes, by taking lots of vinegar, for instance, or they can even buy these cheating kits over the internet. That's fraud, of course, but they do that. They know exactly how to cheat the drug tests, but they can do that with a screening or preliminary test.
Yes.
If the sample is taken and shipped to the laboratory for confirmation, you cannot cheat that.
Okay.
You cannot cheat that because you can add whatever unless you add swimming pool chlorine or strong oxidant, for instance, then of course it oxidizes all drugs. But if the sample is taken in a way that is legally defensible, that preserves the integrity of the specimen, you cannot cheat the confirmation test.
Can't cheat that. But now some substances actually leave your system after a period of time, and then if I understand correctly, you can still pick it up in the hair test.
Absolutely, unless you shave your hair, but then we can wait another month, and because hair grows at 1 centimeter per month, so if there was any drugs in the system, it will be accumulated in the hair as well. So one can actually, if you shave off all your hair, it would probably be 2 centimeters of hair in a week, and that will be the exposure after you shave. So we can still 2 millimeters approximately after a week. 2.5 millimeters of hair. We can shave that and detect the drugs if people try to circumvent or cheat the drug test. So here is a very, very nice unique matrix because it records what's going on. You can dye the hair, you can bleach the hair, of course. That is very possible to do. So you have that problem, of course, but maybe you still have 50% of the drugs in the hair remaining. You cannot really destroy everything unless you cut the hair. And then there's other body hair as well, which is sometimes very uncomfortable to supervise when that is sampled. But you have other body hair like armpit hair and pubic hair and beard and all hair, but head hair is actually the best because we can actually profile 1 centimeter per month.
That's very interesting. So the substances remain in your hair, and unless you cut it, the history is there. The entire history is there.
You can detect, it's been shown in literature, in scientific literature, that Egyptian mummies' hair contain cocaine after 5,000 years.
Goodness.
So you can still detect it. It stays there. It's fairly stable because it's a keratinaceous matrix. It's a protein matrix, so it's fixed.
Very interesting. Now, just for practical reasons, this might sound like a strange question. A hair of my length, for example, how many months or years of history will I have here compared to the length of your hair, for example?
How long is your hair? Maybe 45 centimeters?
Let's say it's that.
Yeah, that would be 45 months.
Okay, so it's a centimeter per month.
Centimeter per month. But remember, after 3 months, the hair doesn't grow at the same rate anymore because it starts to spread out. Some hair strands grow faster than others, so it becomes spread out. So the segmentation is not as accurate as in the first 3 months.
Okay, so it's the new growth that gives you the best results.
Yes, yes.
Fascinating. I don't want to sound like we are giving tips to those who want to abuse the tests and duck them and cheat them, but it's interesting information. Thank you for that. Okay, so in your experience with divorce and child custody cases, where's the what's the word I'm looking for? What's the criteria for deciding that the drugs use is too much? Or is it numbers? Is it levels? What are we talking about? So like you said,
for alcohol, we have that numbers. For alcohol, we have it.
Okay.
There's also some international levels by the Society of Hair Testing, which is established in Europe and America. So where they have certain levels and say above this, it is inappropriate. But for alcohol, there are definitely, and it's very accurate, definitely certain levels above which one shouldn't go. At a certain range, it's inappropriate use.
Yes.
I don't know if there's really appropriate use of illegal drugs. Perhaps prescription drugs, one can use a therapeutic index as appropriate use. But for illegal drugs, there's no appropriate use because that indicates risky behavior already.
And it's illegal. So if it's in your body, you've broken the law.
Yeah, it's illegal. So you have to put together all this information to build up the picture and not use. And it's also important, for instance, in the case of alcohol markets, like CDT, if it's outside a normal reference range, it doesn't mean this person is an alcoholic.
Mm-hmm.
Or he uses alcohol inappropriately. One must really look at all the factors and then make a conclusion, not only on the value. As I showed the other day with a case study where the person came to me and said, look, I'm positive for CDT, I'm above the threshold. I'm above the upper limit that I'm allowed to. So I said, go to another lab. I want to check this test result. And she got a value that was completely within the reference range, in the normal range. Now, which result do you now trust?
Yes.
Eventually, it came down to that the two labs used different analytical methods.
Mm.
But that's information that the mediator never actually look at.
Okay.
They must have that information. So she actually used the second lab report, and it's okay. The family advocate were happy. But there's no point in doing testing like that. So she could have had some kind of mutation in her CDT that this first method was actually influenced because of that.
Mm.
So the testing methodology is extremely important. And also, we have all this expensive equipment in confirmation forensic laboratories. It's like 2 or 3 million, 4, 5 million rand per. But that can also be a preliminary test if it is not used correctly.
Mm-hmm.
It needs to be used by a properly trained forensic scientist in chemistry and toxicology, not a microbiologist or a botanist or whoever wants to make money, because that test must eventually be defended in a court. And the microbiologist would not even reach the court because of the skills. So they won't even question that. So the money is actually wasted. I cannot stress that enough. So you can have all the wonderful technology in your lab, but if you're not suitably qualified, it also means nothing because the court is not even going to listen to you. And that is the problem, I think, in South Africa, because drug testing is not regulated, and therefore these preliminary screening testing devices are sold by people that has a very low qualification. They actually don't even know the implication of the drug test result, and they sell this, and they are never ever held accountable. They never get to the court situation, and they keep on selling. So they never have even to explain their test results because in a court, nobody will even listen to them.
Yes.
But they actually have a huge impact because they sell all these devices to the big pharmacies in our country where people buy this, and it's in the face all the time, and people don't even realize the harm that is actually caused by this ignorance.
So if I had to go for tests, where do I go? How do I know that I'm going to the right place where the test will be properly done?
first thing you have to look at the credentials of the scientist. He must be a forensic scientist. He must be trained in chemistry. So forensic scientist is not a microbiologist or it's a forensic chemist. So pathology laboratories don't have these people. They are pathology people.
Yes.
So one must be really careful. Look at the credentials of the laboratory, the testing technology that is used, because some of these tests are advertised as the most accurate screening. Now, I cannot even imagine how you can use the two words in the same sentence next to each other. Accurate screening. There's no such a thing. It's a screening test. It's actually embarrassing to hear such. But those are the typical or 6-panel tests, or 18-panel tests. There are people walking around in South Africa who doesn't have 1 day of university training, but they administer and sell these tests. How is it possible that this can happen? So be very careful. Use proper forensic toxicologist laboratories, skilled, and that can assist you in your interpretation and can defend those test results in a court.
Yes.
So the first thing is to ask the person, would you be able to defend this test result in court? That would be the first question. And see if they are willing to defend these test results in court. If there's any doubt, don't use them. They will tell you immediately, I can defend this test result in a court based on my chemistry background.
Yeah, well, that's very valuable information. Thank you for that. Just another thing that came up for me as I was listening to you, when you do these tests, can you test for just one substance? Let's say, for example, you suspect somebody of using heroin. Can you do test just for that? Or is it a combination of tests that test for more than one substance?
You can test for more than one, depending on your method. But if you talk about heroin, you zoom in on the marker for heroin only. It's possible to do that. But anything or a drug that is related to heroin will also be detected. So maybe it's not heroin, maybe it's methadone. Mm-hmm. And the people did not even know it's methadone.
Yes.
Which is the substitute for heroin. So we can really detect a vast range of substances and give you proper information. And as I said, we can, in this process, then also look at the ratios to tell you whether this was codeine, legitimate codeine use, was it inappropriate codeine use, was it CBD oil, or was it cannabis use? So now the cannabis actually claims that he used CBD oil. So that excuse you can also now get because the CBD oils are contaminated. So there's a way to differentiate between legitimate cannabis users or CBD oil users by looking at the ratios. So that's the information that you will get from a forensic confirmation test, yes, which a preliminary test won't. And then, of course, these preliminary tests are not designed for all the drugs because they detect 5 or 6 families of substances. What about all the new drugs, the designer drugs that are sold over the internet? That won't be detected with a preliminary test. And people refer to that because they go undetected. They know exactly how they get detected. Don't think the drug abusers don't know how to avoid a positive test. They know it better than us. So, yeah, these preliminary tests really have a limited application. So the forensic confirmation test with the correct technology, with the correct person, then you have reliable results. Nowadays, we have a culture of button pushing in our scientific profession as well. And button pushing, everybody can push a button and get an answer, but it depends on how you interpret that answer.
Yes.
That's where professionalism actually comes in.
Very important. Dr. Lourens, in your experience, do people use, or drug users, do they use one drug or more than one? I'm thinking of things that I've heard about alcohol being the gateway drug, or even cannabis being the gateway drug. Serious drug users, do they use a variety of drugs or do they have one?
Look, if they're getting tested, they vary. Yeah, if they know they're going to get tested, they vary. And if they know how they're going to and when they're going to test, they vary their drug use patterns and substance as well. But if cocaine is expensive, if they cannot get hold of cocaine, they would use methamphetamine. Because it is So they vary because they need that dopamine effect. So it's not only one substance. They would go for anything they can get hold of
I
to
see.
give them that dopamine high. So it's a combination.
So they'll have a backup plan. So
Yeah,
it makes sense to maybe test for a variety of things.
yeah, it does. It
Yeah.
does.
Okay. Very interesting. Very interesting. So is there any other practical advice or tips that you could give us in families when we're going through divorce, we're having child custody disputes, and there's drugs or alcohol abuse involved?
First, confirm the presence of the substance,
Mhm.
the specific substance, not a family of substances, because then it actually confuses the whole picture.
Mhm.
Try to assess what if the substance is present in the person's body, because then you have grounds to stand on. That would be my first point, and I would do the confirmation test in hair, because that will give me an history, and then you know exactly what you're dealing with. Before that, you have only accusations. And then once you have done that, you can assess the amount that was used, whether it's chronic, whether it's binge drinking, for instance, with other markers. But first establish and prove the presence of the substance in the person's body. And the fact that it's 3 months after doesn't mean it's out of the body. It's still in the hair. So you still have the history. It's there.
Yes. So it's important to get reliable results and work from that. Yeah.
Yeah.
Makes perfect sense. And can you give an indication of what such tests cost?
In the order of 2,000 Rand for these confirmation tests. But now if you compare that with a screening test, so that would give you 2,000 to 3,000.
Would that be for a hair test?
A urine test 8 times, that would be 16,000. So the hair test is really cost effective as well, and you have reliable evidence.
Okay.
So if you want to know in terms of short-term information, did this person take this within the past week or 2 weeks, urine testing is okay. But hair testing really gives you a reliable and sometimes the hair laboratories also do preliminary screen testing in hair as well. Remember, there's selectivity problems. With these preliminary screening devices, you always have uncertainty about the identity of the substance and the quantity. So stay away from those. If you want reliable information, have it done confirmation.
And lastly, can you do these tests on a person of any age? Why I'm asking is that I've seen cases where parents would overdose young children on pain medication and stuff to get them to sleep.
Yeah, we can detect that in the child's hair. We can also detect if the mother used substance while she was the hair of the baby as well. To identify. So it's really, it has, where there's hair, there would be substances, not only drugs, but all substances in your body would be absorbed into your hair to a certain extent. We can tell you if you have a zinc deficiency or a vitamin deficiency or mineral deficiency. So it is really that not really very much. It's such a wonderful tool to use to get reliable information.
Fantastic. This has been most informative. Thank you so much, Dr. Lourens. I really appreciate your time and explaining this to us. Yes, thank you so much. And I'm sure this is going to be very informative for everybody who watches. I will put Dr. Lourens's contact details in the comments below this video, wherever it gets posted, so that you'll be able to get hold of him and deal with his laboratory. We know that you've got the experience and the background and the insight to do it the best way.
Thank you very much for having me here. I appreciate it.
Okay, take care.